FDR's polio infection and subsequent paralysis is well known to Americans, but the ultimate cause of his death was his high blood pressure. The president remained in good health for the first 10 years of his presidency, but his close family and advisors noticed a decline at the end of his third term. In 1943, after returning from a conference in Tehran, the president contracted a flu. His health declined over the course of weeks, leaving the president pale, gaunt, not eating, and taking to bed early. In 1944, he acquiesced to his family's concerns and underwent a complete physical, where he was diagnosed with hypertension, heart failure, and acute bronchitis. His blood pressure at this time was 186/108, which many doctors today would call hypertensive urgency, an indication to take medications to lower your blood pressure. At this time, the treatment for heart failure was a drug called digoxin. This medication is developed from the Digitalist plant, which helps slow down your heart rate and gives the heart more time to fill with blood. It also increases the contractility of your cardiac myocytes, causing your heart to squeeze out more blood with each pulse. While the drug has largely fallen out of favor with modern doctors, it was the mainstay of treatment for heart failure back in the 1940s. The addition of digoxin, combined with a reduction in his smoking and alcohol, seemed to give the president a new lease on life. In 1945, the president traveled to Yalta to meet with Stalin and Churchill. Critics would later call FDR the sick man of Yalta, but he was still a man in charge of his facilities and intensely led the debates over the current war and the world's post-war future. Following the conference, FDR displayed a rare openness about his paralysis. Usually, he had left his wheelchair out of the public eye, but for the first time in March of 1945, he had his Secret Service agents push him in his wheelchair in the House of Representatives. Whether this was a reflection on his deteriorating medical health, that he could no longer tolerate his leg braces, or a desire to finally show his physical condition to the American public, we will never know. On April 12, 1945, the president was posing for a portrait in Warm Springs, New York. The painter reported the president's pallor seemed to have faded, and he looked like his old self. As he was sitting down for lunch, the president had a huge pain in the back of his neck. Then he slumped forward in his chair. At this time, the president's blood pressure was a whopping 260/150. Given his extremely elevated blood pressure, combined with the large pain in his head, the doctors determined he died from a subarachnoid hemorrhage. This is when the vessel walls of an artery become so degraded and thin, and elevated blood pressure blows the artery wide open. There is subsequent bleeding between the arachnoid and pia mater. Today, interventional cardiologists or neurosurgeons could clip the bleeding and reduce the pressure on the brain, but there were no treatments for a subarachnoid hemorrhage back in the 1940s. If FDR lived in a time with more advanced medical therapies, it is likely he would have lived longer into his fourth term. But sadly, we lost one of the most iconic and influential American presidents at the young age of 63.